Hey guys, I'm super excited that you're here listening today. In this lesson, I'm going to talk about performing cardiac monitoring on the patient. So, cardiac monitoring should be performed on a patient with any heart concerns by EKG, telemetry, auscultation, and pulse palpation to assess the rate and the rhythm of the heart. This is the main thing that I want you to remember throughout everything that I talk about in this lesson. So, with cardiac monitoring, we want to assess the signs and symptoms of the patient. And we also want to consider different monitoring devices that we may use on our patients. Why should we monitor our patient's heart? Well, there are many reasons. If a patient has an abnormal heart rate or rhythm, it may be current or history, then we should be considering monitoring their heart. If a patient comes in and they complain of chest pain, or if they've already been admitted for a few days and suddenly they have chest pain, we should be considering calling the doctor about heart monitoring as well. Another example is if your patient comes in and they have syncope, or they're feeling dizzy, they feel like they might pass out, they're sweaty, they may be having heart issues. Electrolyte imbalances can affect the heart. And another thing to think about is if a patient comes in with alcohol withdrawal, their electrolytes are probably all off, and so they're going to need some cardiac monitoring as well. How do we monitor a patient's heart? Well, there are two separate things that I want you to think about, which are nursing judgment and doctor's orders. Our nursing judgment includes different things that we can do on our own without a doctor's order. And doctor's orders are things that we must call the doctor or talk to the doctor about if they haven't already put those orders in. So, for nursing judgment, some things that we can do, we want to be listening to the patient's heart, and we want to palpate their pulses or feel their pulses. And we may also use a pulse oximetry device on our own without a doctor's order. What a pulse oximetry device does is it helps us to keep an eye on the patient's pulse, and it shows us how much oxygen they have in their blood for their body to use. Now, if you're concerned about your patient's heart, you may need to call the doctor and get different orders. For example, if your patient is having symptoms or their pulse is feeling off, you may decide that it'll be helpful to monitor their heart. Doctor's orders that we may implement include an electrocardiogram, which is a single measurement. And so EKGs are a little more advanced than just telemetry because they can show if a patient has had a heart attack or something recently that may have occurred with their heart. Telemetry is a little more short term, but they may wear it the whole time that they are in the hospital. And it allows us as the nurse to look at their heart on the heart monitor to see what it's been doing. A Holter monitor is something that the patient can wear a little more long term. They can go home with that, and the doctor will be able to review it and see what their heart has been doing while they've been at home. Troponin lab values. So if a troponin lab value is coming back elevated, that shows if the patient has had any heart injury. Troponin lab values, you may see different guidelines depending on what facility you're at. For example, you may see like 0.01 to 0.035. It just depends on what your protocols and guidelines are in your facility. That may be an okay range right there, but anything above that would bring concern to you and the physician. So if a patient has a troponin lab value that's greater than the guidelines, then you will be concerned. And the doctor will probably want to check those troponin values every 4 hours or so just to make sure that they're going down and not up. Because if they are going up, the doctor may be concerned that the heart is damaged. Okay, so when we are doing telemetry monitoring, we usually use a 5-lead EKG placement. So for placing the patches, the white lead is going to go on the right upper chest. The green goes below the white. The black lead goes on the left upper chest. The red below the black. And the brown is kind of in the middle towards the right. How are you ever going to remember this? Well, there's different little sayings and ways to memorize the lead placement. So what I like to use is white on right, snow over grass, smoke over the fire, and chocolate warms my heart. You will find that once you begin nursing, there are also different kinds of telemetry packs out there. And a lot of them, you can just either look at the back, or there might be like a screen that you can go into, and it will show you where to place the patches for that specific monitor. So just make sure you look at that. And also, you may also use a 3-lead EKG, which just involves the black, white, and red leads. Some important things that I want you to remember is that you should clean the skin before you place the patches on. Okay. You can even just delegate this to the CNAs. When they bathe the patient in the morning or whenever they take a bath, they can just take them off, bathe the patient, and then put new ones on. And remember that when you put new ones on, you want to just move them over an inch or so to the left or the right. That way, that skin can get a break and you can help prevent wounds. These should be changed every day. And you want to assess the skin under the patches just to make sure that nothing's going on under there. Something I want you guys to remember is that you should always check the pulse oximeter. If you look at the pulse oximeter and it's showing that a patient does not have a pulse, they may be in pulseless electrical activity, otherwise known as PEA. This needs immediate intervention. You may notice when a patient is in PEA that the telemetry still is showing a heart rate. So you might still see like a little thing going on there, but this is because the electrical activity is still occurring in the heart, but the heart is not pumping. So just remember, a pulse is the mechanical activity, and the heart rate is the electrical activity that happens in the heart muscle. So in this situation, I want you to keep that heart pumping. So that's very, very important. You're going to be performing CPR, and per doctor order, you may be giving epinephrine. In this situation, you would want to call a code on the patient to try to keep that patient alive. If a patient has chest pain or they start to feel like their heart is racing or something's just not right, they should be contacting you right away and letting you know. So just make sure you tell them to let you know if any of these symptoms occur. All right, guys, so our nursing concepts for performing cardiac monitoring include clinical judgment, EKG, and lab values. Okay, so key points that I would like you to remember include 1, the nursing assessment. You will listen to the heart and you'll feel the patient's pulses. 2nd, I want you to remember the reasons to monitor the patient's heart, which includes syncope, chest pain, heart history, electrolyte imbalances, and your patient in this situation probably should have a heart monitor on. So different devices that you may use include telemetry, pulse oximeter, EKG, and Holter monitor. Now that pulse oximeter, that is the only one that you may implement on your own without a doctor's order. The 4th important thing to remember is the EKG 5-lead placement. So just remember white on right, snow over grass, black upper left, smoke over fire, and chocolate warms my heart. Sometimes even drawing these out might help you a little bit. The last thing that I would like you to remember is that PEA stands for pulseless electrical activity, and it is an emergent situation. The patient does not have a pulse in this situation. Thank you so much for listening to my lesson on performing cardiac monitoring. Please make sure you check out the resources that I've attached to this lesson. We discussed performing cardiac monitoring in this video, but we did not address the EKG strips and how to read them. Please check out the EKG course to learn about reading the telemetry and EKG monitors. Now go out and be your best self today. And as always, happy nursing.